University of Science and Technology, and today I'm going to perform the nursing care procedure, which is the normal delivery. Ensure the privacy and dignity of the woman. Make her feel comfortable. A male doctor needs a female assistant while performing the examination. Ask if she has understood what is going to be done and ask her permission before undertaking the examination. All equipment, medicine, and disposable should be made ready before the pregnant women are brought into the delivery room. The woman is to be moved to the labor table in the active stage of labor. Unnecessary pushing in between contractions should be avoided. Ensure the woman is hydrated and the bladder is empty before encouraging the woman to push. All neonatal equipment for ENBC and resuscitation should be pre-checked and kept ready until the pregnant woman is brought in. The room temperature should be maintained in the range 26 to 28 degrees Celsius. In the labor room and chilly areas, will need heaters during winter. Provide emotional support and reassurance as feasible. Encourage the presence of a birth companion. For the planning, prepare the equipment and materials. Helipad, drainage pail, sterile OB pack, which is gown, OB sheets, drape towels with or without instrument, sterile gloves, normal delivery set, arranged according to order use, sterile pads, suction bulb, 2 straight forceps, 1 surgical pair of scissors, placenta bowl, syringe 5 to 10 cc, hypodermic needles, aspirating gauge 19 to 21, injecting gauge 21 to 23, chromic, needle holder, thumb forceps, and tissue forceps. For the implementation, change into a doctor's suit. Put on personal protective attire, which is wear goggles, mask, cap, shoe covers, plastic apron. Palpate the suprapubic region to ensure that the woman's bladder is not full. If it is full, encourage her to empty the bladder or catheterize. Wash hands and put on sterile gloves. Clean the woman's perineum with sterile swabs. Talk to the woman and encourage her to take breaths through her mouth after every contraction. When the head is visible, Encourage her to bear down during contraction.
Support the perineum with one hand using a clean pad and control the birth head's birth with the fingers of the other hand to maintain flexion, allowing natural stretching of the perineal tissue to prevent tears.
Allow the baby's head to turn spontaneously. Then, with the hands on either side of the baby's head, deliver anterior shoulder by gently moving ahead a little downward, which allows the shoulder to drop down the symphysis pubis. When the axillary crease of the anterior shoulder is seen, deliver the posterior shoulder, lifting the baby upwards towards the
Support
mother's
the rest
abdomen.
of the baby's body with one hand as it slides out and says, "Baby out." Note the baby's time of birth and sex and show the mother. Place the baby on the mother's abdomen over a clean, dry, pre-warm towel in a prone position with the head turned to one side.
Quickly dry the baby with a pre-warmed towel. Discard the wet towel. Wrap the baby loosely in the second pre-warmed dry towel. Delay cord clamping for 1 to 3 minutes if the baby is crying or breathing well.
Palpate the mother's abdomen to rule out an additional baby or babies, and proceed with active management of the third stage and ENBC. Look for any vaginal or perineal tears. If present, assess the degree of tear and manage accordingly. For third-degree perineal tears, refer the woman immediately for higher specialized care with proper sterilized perineal dressing.
The evaluation, maintain aseptic technique. Throughout the procedure, cleaning of the labor table should be done immediately after the transfer of mother to the postnatal or observation ward. For the documentation, do the charting.